antibody testing in practice. Now, this slide that's on the screen now is simply the representative slide based on the recommendations for vaccinating the young dog. This is the initial series. And I think virtually all of you are doing something very close to this, recommending 3 initial doses for distemper, parvo, and adenovirus, generally around 2 months, 3 months, and 4 months of age, with some wiggle room built into that for clients who don't comply. And then, of course, a booster 1 year later. Now, if you look at this in another way, I wanted to incorporate maternal antibody into this slide. You see the 8 weeks, 12 weeks, and 16 weeks across the bottom. The purple curve that's denoted here represents maternal antibody. Maternal antibody we don't specifically measure, but we assume it's there. And one point that's critical, maternally derived antibody is the #1 reason that vaccines fail to immunize. That's why we administer 3, or in some cases 4 doses of vaccine to the young animal, is to be there with 1 dose when maternal antibody is not there. Now, for years, we have given a dose at 8 weeks or so. If maternal antibody is present, maternal antibody will effectively neutralize the vaccine antigen, and there is no immunity. So we have administered vaccines at 3 months of age, 12 weeks, and if there is sufficient maternal antibody present, there is not going to be an immune response to those antigens. Hence, we've recommended several years ago that a 3rd dose was very important, and we have assumed for several years that 16 weeks, no concerns about maternal antibody interference, and the patient can reliably be considered immunized. And within about 7 days after that last dose at 16 weeks, the clinician and the client can be relatively confident the patient is immune. But new data, not yet published, out of the University of Wisconsin has done some serologic surveys across the United States. Thousands of dogs are involved. And what we have discovered through these studies is that as many as 15% of dogs in the United States vaccinated at 16 weeks of age are not immunized for distemper and parvovirus. This was quite a revelation, and it does raise concerns that maybe we're not immunizing the entire population at risk. The question then comes up, did this patient actually become immunized? Now, here's the scenario. You have a client who now owns a very valuable dog, a $4,000, some kind of a doodle, and they want to travel with that dog, and they do. They go to shows, they sell these dogs at dog shows. Their airplanes are filled with dogs today. It's remarkable when you see that. I think in the case of the individual client, this would be a very valuable, useful asset to be able to test that patient after the completion of the the initial series of vaccines. And what we are recommending today is that if the antibody test is done 2 to 4 weeks following the last dose to give antibody an opportunity to be induced, then that would give you insight into whether or not the patient is truly immunized. Now, if it is negative, interestingly, then the actionable item would be to immediately revaccinate that dog. So it would be a recommendation to give an 18 or 20 week dose of vaccine. that gives you the confidence, at least, of knowing that that patient, before it gets on an airplane or begins going to dog shows or daycares or whatever, has exposure to other dogs, is in fact immune. While this isn't for every client, it is, I think, an option for specific clients that may want that kind of information and who may own a particularly valuable dog or a group of dogs, to have that kind of information before they begin the increased exposure risk. Interestingly, if that patient, when it's retested, is still negative, there's another issue at concern. This is not maternal antibody. I think many of you remember the Doberman parvo and Rottweiler parvovirus failure to immunize from the 1980s. This was a subset of dogs that failed to respond to the parvovirus vaccines at a time when parvovirus was raging throughout the world. So we find that this is not maternal antibody. In fact, it's a very, very select genetic flaw in that these dogs apparently fail to express the epitope on the antigen presenting cell that binds to the parvovirus antigen. They do fine with distemper. They do fine with adenovirus, just parvovirus. Now, we have noticed, and this is more recent, that there are concerns being expressed by veterinarians of families, groups of dogs or breeds that are not responding to parvovirus vaccine. One of the concerns that has been expressed to me, and this is from the East Coast to the West Coast of the United States, is an increase in parvovirus cases among well-vaccinated pit bull terriers. I've had one case in, I believe it was Massachusetts. A veterinarian called me and they had 4 pit bull pups, all vaccinated out to 19 weeks, all of which developed parvovirus between 6 and 9 months of age, all of them. And I think that knowledge that these dogs responded or didn't respond to vaccine may have at least helped make a difference. The fact is, if they do not make antibody, they are not protected. They are susceptible in that situation. So it's a piece of information that I think is particularly useful in the clinical setting.